My topic today is newborns, do they have pain? And how can you tell? Well, you got this newborn in the nursery. It's your first baby and you're holding it. You're caressing it. You're caressing it. And all of a sudden, this mean nurse comes up and pokes the baby in the foot. The baby starts to cry. Does that mean that the baby has pain? Well, according to this university or Oxford University study, it does. That baby has pain. We know babies cry when they're sleepy, when they're wet, when they're uncomfortable, when they just want to be held. But does that mean that they're in pain? Well, let's talk a little bit about this Oxford University study. You know, I'm all about looking at the facts and not the alternative facts, but the facts to support my position. It may not be your position, but I'm giving you the facts, and then you get to decide. What happened in this Oxford University study, they took 10 infants, basically newborns, from day 1 to 7. And then they took 10 adults aged 26 to 32. And what they did is they looked at when they invoked pain or they gave them a painful stimulant, did their brain or their MRI change? So let's look at the study in a little more detail. Real quickly. So these babies were put in an MRI. They were poked with a needle in their foot, just like they do in the nursery to get blood. So almost all of us have been poked in the foot, so that's nothing new. So they poked the babies in the foot. Then they looked at the MRI of their brain. They compared that to the MRI of adults. They did very similar in terms of procedure, except adults got crusty, hard feet, and instead of a little tiny needle, they used a big knife. No, they used a blade. But they poked them 4 times. And they compared the MRIs of the baby to the MRIs of the adults. And voila, what do you think happened? Well, they did have pain. Or, let me say, it's not the conclusion they did have pain, but they did have changes on the MRI that were the same brain light up activity as the adult, suggesting that the baby's brain also experienced pain. Well, when I was in medical school in the early 90s, they told me that, listen, babies' brains are not developed to the point where they can experience pain. Well, this study say it ain't so. So, what are we going to do about it? So the whole point of studies is to create some kind of change. So does that mean that we're going to start to have these little charts for babies? Like, is it a 1 pain, 2 pain, or 3 pain, or 10? Well, babies can't talk. I don't know how that would work. So more needs to be discussed, but we do know that possibly babies have pain even as early as 1 day. So you parents need to be the advocates, like my mama. When my brothers and sisters would cry, she'd say to my husband, Elijah, get in there and get that kid. That's a serious cry. He's got something wrong with him. Get in there. And other times she'd sit back and say, Elijah, leave him. He needs to learn how to comfort himself. In other words, that wasn't a serious cry. So we need to get moms involved because they know the pain cries and the not so serious pain cries.